For the Orioles, the designated hitter, number 33, Eddie Murray.
Welcome to Sports Central. Our guest is Hall of Famer Eddie Murray.
Glad to be here.
You're one of Maryland's all-time favorite athletes. How would you like your fans to remember you?
Well, right this moment, I'd like them to remember when they called me Easy Eddie.
Why is that?
Starting this year, there's an easy enrollment for HealthCare if you're not already insured.
I know about that. Marylanders can apply for health coverage by checking a box on their state income tax return. The state will begin the process to offer free or low-cost insurance to anyone who qualifies.
Yeah, on your tax form, just say yes to HealthCare. It's that easy.
Thanks, Eddie. If you need health insurance, say yes on your Maryland tax return. It's a home run. For more information, see MarylandHealthConnection.gov. Sponsored by the Maryland Citizens Health Initiative Education Fund.
Hey, hi, you're listening to Urban Health Beat 2.0, the podcast. I'm your host, Marilyn Harris Davis, and I'm joined by
Dr. Garry Jennings.
Urban Health Beat is a show that feeds your mind, body, and spirit. And we are here to do all three. We keep you informed with the latest in healthcare information and education. So keep listening because we have an exciting guest that's going to give you that kind of information today about healthcare information, education, and updates on what we can do to keep our health safe. So we're going to welcome the Maryland, okay, I'm going to get this title right, okay, because we have a couple of them. We're welcoming the Deputy Director of the Maryland HealthCare Initiative. Now, we also call it a couple of other things. We call it Healthcare Access for All, which is what we all want. It's healthcare access for all. Clearly. I can tell you with my own experience, it's like we want to make sure that everybody has health care. Right, Dr. Jennings?
Definitely. I have bills I have to pay.
Okay, yeah, well, then there's that. And Maryland Healthcare for All and Healthcare Access Maryland, correct?
Maryland Citizens Health Initiative.
Maryland Citizens Health Initiative. Okay, we have the Deputy Director, Stephanie Klapper, with us. Welcome to Urban Health Beat.
Thank you very much.
Thank you so very much. We have had her director, Vinnie DeMarco, on Urban Health Beat when we were on the radio.
Right, yeah.
Before we became 2.0 and became the podcast. And Mr. DeMarco assures me that Stephanie is the guru behind a lot of these new healthcare initiatives. So we're really fortunate to have you. So Stephanie, you all are rolling out, we're going to get to what you have done in the last 20 years because the Maryland Citizens Healthcare Initiative has been around for the last 20 years.
That's right. This is our 20-year anniversary.
Wow, that's amazing. It's been a battle. It's been an uphill battle. We've been in and out of administrations. We've had one really good 8-year period where we got a lot done, I'm sure. And we've had a good governor. So I think that, we're moving in the right direction, and with your help, we will continue to provide health care to the unserved and underserved.
Well, thank you, Marilyn. I'm really excited about our anniversary, and two things in particular that we're celebrating are the 2008 tobacco tax increase in Maryland, because we were able to generate a lot of funds from that increased tax, and so even before the Affordable Care Act, we were able to expand Medicaid to many Marylanders. And in addition, just by increasing the tobacco tax, we also saw that teen smoking went down from 17% to 19% had said that they smoked a cigarette in the past month, which is great. If they don't smoke when they're younger, they're less likely to smoke when they're older. Yes. And then in 2011, with our alcohol tax increase, we actually saw that binge drinking went down, and the number of teenagers who reported getting into a car with a drunk driver went down by 31%.
31%. That's huge.
Yes, I'd call that a big public health win.
So when you talk about the fact that kids are smoking less, does that include vaping, or does that tax cover the vaping, or it doesn't?
The 2008 tax includes just traditional tobacco, so it does not include vaping.
Yeah, vaping is another topic that we're going to cover in a couple of weeks, actually. So you all have had a lot of success with the tobacco. The tobacco tax. It has deterred folks from smoking.
That's right. And actually, there was a really great ABLE report published that is on our website at healthcareforall.com.
Okay.
And it goes into all of the details about what kinds of things decreased when the tobacco tax went up and also when the alcohol tax went out.
Yeah, 31%, that's huge.
It is. It
That
means
is
a lot
really huge.
more
It's almost half.
safe kids on the roads.
That is almost half. That's almost half. So, in this last 20 years, you have been successful with so many things, but right now, you are trying to, how should we put it, combat against federal attacks on the Affordable Health Care, on the Affordable Health Act.
Right.
So, tell us about those battles.
Okay. Well, the very first thing I want to highlight is a new program that is starting this week. It's called the Easy Enrollment Program.
Yes.
And it's a new way for Marylanders who don't have insurance to use their state tax return to get signed up for health insurance.
Right.
Really? How does that work?
So when they're filling out their Maryland state tax return, there are going to be some questions asking if they have insurance. If they don't have insurance, it'll ask, would they like for the Maryland Health Connection to reach out to them and let them know if they're eligible for health insurance and if they're eligible for it at free or low cost. And actually we estimate over 130,000 people in Maryland who could get free or very low cost health insurance.
Oh my
They
gosh.
probably don't even realize it, but through their state tax return, now they can easily find out if they check that box.
Absolutely. And you all give them, because you all have navigators in the Maryland Health Initiative, as I understand.
So the Maryland Health Connection has
Health
many
Connection,
navigators
yes.
that can help out. And the Maryland Health Connection also contracts with many local organizations to
Yes.
help them. So people should know that they can get free help to figure out the best health insurance plans for them and for their families. And you can learn more about the Maryland Health Connection on their website, marylandhealthconnection.gov. But the key thing to remember is if you don't have insurance, on your Maryland state tax return, check the box that lets the Maryland Health Connection reach out to you. Find out if you can get free or low-cost health insurance. It's the best gift that you can give yourself and your family this tax season.
And it's so easy now. You just check the box.
And that's why it's called Easy.
That's right. And speaking of easy,
Right? that was a segue for you.
yes. We're very excited because we have Eddie Murray, Orioles Hall of Famer Eddie Murray, who's going to be joining us tomorrow at a press conference in order to kick off the Easy Enrollment Program. Now, Eddie Murray, one of his nicknames was Easy Eddie,
Right.
because he made baseball look so easy. And so, Easy Eddie is going to be with us. He's going to be at the press conference, and he's also launching radio ads with us in order to let Marylanders
Yes.
know that this program exists and that they should be checking that box on their state income tax returns.
Yes, and that ad will be on this podcast, by the way, one of the first. This Easy Enrollment Plan is one of the first in the nation or the first in the
This
nation?
is the first in the nation.
Wow.
And some
So
states,
Maryland is up there, yeah.
Yep, that's exactly right. It's innovative. I especially want to thank Delegate Pena Melnick and Senator
she's
Feldman.
wonderful.
Yes, both
Oh,
wonderful legislators, and
is.
so they were the
She's
lead
good.
sponsors for this legislation. It passed almost unanimously. It was bipartisan, and the governor signed it into law. And so we want to thank the governor, the General Assembly, and our lead sponsors for this great legislation.
Absolutely, absolutely. So tell us about some of these battles with the federal attackers. I mean, honestly, we've gone up and down, and I understand that the current president kind of gives two sides of a story. He says he's going to protect pre-existing conditions on one hand. On the other hand, he says he wants to get rid of the Affordable Care Act. We affectionately call it Obamacare. Sometimes I kind of said, I don't want to call it Obamacare, but I got to tell you, the President Obama himself said, I'll take credit for it because it's so good. Yeah, you can call it Obamacare. So, Obamacare. But but I guess on a local level and maybe on a national level, you all have faced opposition relative to moving forward with this. And honestly, from what I understand, I could almost see it if there was an alternative plan, but maybe I don't know an alternative plan. And maybe you do, I don't know.
So I think it is disappointing to see all of the federal attacks on the Affordable Care Act. I mean, let's talk about why this is important.
Yes,
Over 400,000 people in Maryland have health care because of the
Because
Affordable
of
Care
it.
Act.
Jeez.
That's right. And we know that there are many more who could get coverage because of the Affordable Care Act who still need to sign up.
Yeah.
That's and
At
then,
least another 130,000.
Right, at least that.
At the very least.
And actually even more than that. But like you said, the protections on pre-existing conditions are so important. No annual lifetime caps, so that if you get sick, you don't have to worry that your health insurance is going to stop paying your bills.
Okay, wait a minute. Let's talk about that. No annual. Have there been annual lifetime caps?
Yes, before the Affordable Care Act, that was a thing that could happen. Your insurance company could say, this is the maximum amount that we're going to
Even though
pay.
you're still sick, this is the maximum? Oh, Lord.
Yes.
Usually it was like,
Did not know that.
was it like 300,000 some places or more?
It was not enough.
Yeah,
what the
Whatever
caps
it
were.
was.
Go through that really easy if something catastrophic happens
Right,
to you.
exactly. So it's extremely important, and we've heard so many stories of success here in Maryland.
Yeah.
Barbara Gruber told us about how she has autoimmune diseases, and without the Affordable Care Act, she would be constantly sick and probably bankrupt now. We've heard from teachers in the Eastern Shore who say that without the Affordable Care Act, they would not have become well enough to work and go back to teaching.
Even though they were teachers with good health insurance, with health insurance, with a cap, maybe.
I'm
I
gonna
don't
be
know.
honest,
I
don't
know you
remember
don't
the
know
exact
every single
details,
story. I get it, but I'm
mhm.
just imagining that if there were health insurance caps, then you might have insurance. But if you had a chronic illness, then the cap goes into effect, and this is where the Affordable
And
Care Act sweeps in.
I'm
And
sorry.
helps
No, I was going to say, I had my own story, and that I do, as an anesthesiologist, I work with a lot of endoscopists doing colonoscopies. And once the Affordable Care Act, we see many, many more men getting colonoscopies and procedures for their prostate that weren't getting it before because they didn't have insurance.
That is fantastic. I'm so glad you've been able to see that at your practice. And then,
Interesting.
Let's talk about when people do get sick. Sometimes you get so sick that you're not able to keep your job. And then
Right.
what? Where do you get your health insurance from? And because of the Affordable Care Act, Medicaid was expanded up to 138% of the federal poverty level. There are subsidies for private insurance up to 400% of the federal poverty level. So, there's more of a safety net for you. If you fall, if you get sick, if you fall in hard times, if you just need to get well enough to go back to work, that safety net is there for you.
Still there. So let's talk about small businesses and companies, because sometimes people will leave a job that has medical insurance or retire or something like that and then go into business for themselves. The Affordable Care Act is indeed an option for them.
That's right. There's actually a very little known product in Maryland through the SHOP program. It's the SHOP program.
SHOP?
That's right,
Okay.
SHOP. It's through the Maryland Health Connection, and small businesses can go on there and they can purchase health coverage for their employees. Not many businesses know about it. Actually, that's something we're trying to increase funding to help the Maryland Health Connection get the word out that this exists. The Maryland Health Connection has been having hearing sessions with small businesses around the state, and they hear over and over again that small businesses don't know about this program. Now, a lot of small businesses that do provide health insurance get it off of the Maryland Health Connection. One of the benefits of doing it through the SHOP program is you're able to have more choices of insurance to give to your employees. So
Such as, I'm sorry.
within health insurance, on the SHOP program, there are different metal levels or tiers of insurance. And so, for example, there will be a bronze,
Gold, silver, bronze.
right? So if
I
you're,
like that term, metal levels.
So if you are a small business, you could say, for example, I really want to give my employees a lot of choice. I'm going to pick silver and bronze metal levels, and my employees can each choose any plan that's silver or bronze across the exchange. And right now there are 4 carriers. That means that those employees would have 8 choices.
Oh, nice.
Right.
Okay.
So that amount of choice doesn't exist outside of the SHOP program. Another benefit is that for some small businesses, there are tax subsidies that you can get through SHOP. They're limited to 2 years right now, and there are some restrictions on which small businesses are able to get them. But I believe that there are many small businesses who are eligible for these tax subsidies and don't realize it.
Don't realize it because a lack of education about it.
Right. And so I'd encourage small businesses to go look at SHOP on the Maryland Health Connection website. And in addition, Senator Katie Fry-Hester and Delegate Robin Lewis are going to be sponsoring legislation this year to expand outreach and also expand the money that goes into the tax subsidies to hopefully make that a more robust program. And so we had a great event where they spoke of Senator Katie Fry-Hester and Senator Feldman spoke about that proposal to the Maryland Chamber of Commerce. Some people came up to me and said that they thought that sounded great. So we're going to be advocating for that proposal this legislative session.
That is really, really good. Now, speaking of this legislative session, don't you have something coming up to benefit us with the high cost of prescription drugs?
That's right. So on prescription drugs, we've heard so many stories of people struggling, and I've got a whole packet of stories with me that I brought today. But one that really stands out to me in particular is Larry Zarzecki. He is a retired state trooper, and he has Parkinson's disease. With insurance, his prescription drugs cost $3,800 a month.
Wow.
What?
That's with insurance.
With insurance?
With insurance. And he cannot afford them. So he has to go without his prescriptions. And, that has bad side effects. When you have Parkinson's disease, you can't take your prescription medication. In addition to that, there's actually medication that would be more effective for him that is just so far away and away expensive, he can't even try it out.
Wow. Wow. Let me ask this. Excuse me for interrupting you, but Dr. Jennings, have you found some of your patients in that circumstance?
Yeah. I mean, sometimes a copay is no pay. You just can't afford that particular copay, especially if your insurance company or you fall into that donut hole that people fall into where insurance was helping.
It's like insurance is covering you, but then it's the donut hole.
Yep.
Right.
And then you fall through that, and now you have to pay for everything. And deductibles are higher than they were. You get the same amount of insurance, but sometimes your deductible goes up. And so you're paying the same amount, say $400 a month you're paying. And this next year you're paying $450, but your deductible and your medications went up. So your out-of-pocket expenses actually
Increases?
And this is the tough time of year because a lot of people's deductibles have started over in January. So this is when they're having to pay for that without that additional help.
And up and up.
And people actually do delay their health care. And there's a big rush before the end of the year in December.
Yeah, because you see all the commercials about healthcare, insurance, and open enrollment, and right.
Yeah, and in December, you want to get it done because in January you're going to have to come out your pocket for it. But if you get it done in December, see the doctor in December, then you're fine. And so people play all of these type of games to save them money and actually live. $3,800 is crazy amount.
Yes, and that's just one of the many stories. Now, sorry to jump around here for
Sure,
a second.
it's fine.
But, you talking about the December visits to the doctor made me remember another thing about the easy enrollment program. A lot of people who qualify for the subsidies for private insurance, private insurance open enrollment through the Maryland Health Connection is usually only open from mid-November to mid-December. That's the open enrollment period. Unless there's some other, something that applies to like a new
Extenuating
marriage,
circumstance
right,
or
special
something.
event, new baby, new family.
Lost a job.
A neat thing about the easy enrollment program is that if you check that box on the tax return and you qualify for private insurance, you get another 30 days to apply for health coverage. Even though it's not the traditional mid-November to mid-December open enrollment period, if you check that box, you get time. So you'll get a letter in the mail about a week after you file your tax return from the Maryland Health Connection. It'll have instructions with the timeline that you have to apply for that health coverage. So that's an extra benefit of the program. So sorry to jump that in here.
No.
Yes.
That was like
That's
second
huge.
most important thing you
That's
said.
huge. That is huge.
Yes.
That is huge. So if you apply for the easy enrollment program, you might have an opportunity to extend your time. to make a decision as
Right.
to which
Right. Even though tax time
carrier you would prefer.
That's right, because tax time is end of January through April 15th. If you check that box before April 15th, about a week later you'll get a letter in the mail. And if you qualify for private insurance, it'll say, you have 30 days, and it'll give you a date by which you have to apply for that private
that's
coverage.
great.
And you don't have to wait until November. You can do it when you get that letter in the
So
mail.
you get a
Oh,
do-over.
that's great.
If you missed it, then you get to
Essentially.
you
You
get
get
to
a
sign up.
do-over. Yeah,
Wow,
right.
essentially it gives you a little more flexibility. That's awesome. No wonder Eddie Murray is so on board with it. He's just like, yay. I mean, everybody has to know somebody that needs that kind of extra time,
That's right.
Everybody. So, all right, so with the prescription drugs,
Right.
so do you all have a specific piece of legislation?
Yes. So maybe to give you a little bit of historical context to leading up to where we are now.
Okay.
So a couple of years ago, we in Maryland passed a ban on the gag rule on pharmacists. Pharmacists were not always able to tell you the cheapest way to get your prescription medication. That's why it's called the
Really?
gag rule.
Who said that? Who made that rule?
It was because of kind of backroom agreements between the pharmacies and the carriers and the prescription drug corporations, where if, for example, if there was, if it would be cheaper to buy your prescription drugs out of pocket rather than use your insurance, sometimes pharmacists were not allowed to tell you that. And so that could make a big
Really?
difference. And they would, want to tell you that as your pharmacist. And so we passed a ban on the gag rule a few years ago, and actually
That's wonderful.
that became nationwide. So there's a ban on a gag rule nationwide now as well.
Excuse me, did you know there was a gag law?
No, I didn't know that.
See, and you're prescribing things.
Yeah, but I'm just a regular person when I walk into the pharmacy.
Well, that's true, but I'm just saying, as a doc, I mean, I would think that you would want your patients to be able to get the least
Yeah,
expensive,
get whatever they need.
whatever
to
they
get.
need
Yeah.
to get without, burdening them. But you didn't know there was a gag rule. Not many of us did, but I'm sorry to interrupt you. So, okay, so you all got rid of the gag rule.
That's right. And so last year, we were able to create in Maryland the first in the nation prescription drug affordability board. That legislation was sponsored by, again, Delegate Pena-Milnick and also Senator Klaus Meyer. And this is huge. What this does is it gives the board the authority in 2022 to start setting upper payment limits for state, local, and county governments. So they're going to be looking at very high-cost drugs and trying to figure out why are they so expensive, and are these the appropriate costs that we should have for these drugs. And so in 2022, with the consent of the Legislative Policy Committee of the Maryland General Assembly, they can start setting those upper payment limits for state, local, and county governments. Now, we've heard from so many county executives that all supported this legislation that because prescription drug costs are skyrocketing, that would take a huge percent of their budget. And that's taxpayer money that could be going to other things. And then after that, the board is going to submit a report to the Maryland General Assembly with its recommendations for what should be done to make high-cost prescription drugs affordable for all Marylanders. And one thing that we think they should look at is setting upper payment limits for all Marylanders, not just state, county, and local governments.
Right, but all Marylanders, sort of like the insurance cap. Let's just cap things, right?
Right. For
Payment limits.
Right.
Okay.
And, as part of the process, there's an advisory board that's made up of many different stakeholders. They'll be asking for data. They'll look at a high-cost drug and try to figure out why does it cost this much. Maybe this is a justified high-cost drug, or maybe it's not.
Maybe it's not,
you
but we
know?
just have to look at it. We have to explore.
Right.
Right,
I
exactly.
mean, we know that pharmaceutical corporations spend much more on advertising than they do on research and development.
Yes.
So,
We know that, right?
So, there are some drugs out there where the United States pays way more than other countries do, and we want to
Indeed.
know why.
Definitely Canada. We want to know why. So what can we do as citizens, what can our listeners do as citizens to help you advance your initiatives?
So there are a few things that you can do. One is we're looking for stories. We're actually hosting listening sessions. The board members are hosting listening sessions all around the state, and we're going to be posting the dates and locations of those sessions on
your
our
site,
website,
which is
healthcareforall.com.
healthcareforall.com.
So we'd love for you to come to those if you're able to come. Share your stories. How are high-cost prescription drugs affecting you?
Yeah, we will post that on the website, healthcareforall.com.
Great. If you can't make it to a listening session, get in touch with us directly through our website. We would love to interview you and learn more about what you're struggling with through your prescription drug costs. You can sign up for our email list. We'll let you know whenever there are action alerts. Right now we're in the middle of the legislative session, so there probably will be action alerts coming up soon.
Yes. And we can show up for some of the hearings relative to these. I mean, and that's always important. I've got to tell you. Showing up for hearings is really, really important. I know people are working during the day or whatever they're doing during the day, and these hearings are in Annapolis. But just to have, a face to the legislation, essentially, as you say, with stories, is critical.
And in some of the legislation we're trying to pass this year is to create a permanent funding mechanism for the board. The board needs to hire staff. It needs to have resources and able to do its work. And so we are going to be trying to establish that permanent funding mechanism so that they don't have to worry about that for years to come.
Right. And which board is this again?
The Prescription Drug Affordability Board.
Prescription Drug Affordability Board.
That's
okay,
right.
Got you. All right, we're going to keep following that because hopefully within the next year you'll be able to get that funding.
Yes, I hope so.
From my mouth to God's ears. Okay, I'm just saying.
And I do want to mention that the board itself is 5 members. The members have all been appointed. It's 1 member is appointed by the House Speaker, 1 by the Senate President, 1 by the Governor, 1 by the Attorney General, and then the chair was jointly appointed by the Speaker and the President.
Really? So you have these appointments happening already?
They already happened, and actually the board just recently had its very first meeting. And so as part of that, they are hosting these listening sessions in the next coming months to talk with the public about the problem.
Absolutely. Oh my gosh. So maybe Dr.
Things are
Jennings.
happening so fast.
Things. I mean, you all are like really, really on it, and a
Only
lot.
like January, right?
Right. It's not even February yet, and you all are really, really, really on it. So you've got the prescription drug, the pharmaceutical lobby. I guess is probably a formidable lobby for you guys.
They are. They have a lot of resources.
Yeah, they do.
Spend a lot of money on lobbyists. But we have Marylanders.
You have the people.
Absolutely, you've got the people on your side.
That's
And you've got Stephanie.
We've got Marylanders who come to us. They tell us their stories, and that makes all the difference. What you were saying about going to the hearings. What we did last year.
Sign up to speak at a hearing, and you can tell your story.
Right.
And that influences legislative votes. It's really, really important.
And if you can't come, tell us your story. We'll take it to the legislature for you. It makes a difference. It really does. When they hear statistics, when they see us again, they see our faces all the time. When a legislator hears from their constituent, this is a real problem. This is how it's affecting me. It means I'm having trouble paying my mortgage. It means that I have to live at home with my parents. I can't move out. It means I can't take care of my mom the way I'm supposed to because I can't afford her medications. It means I have to pick between my kids' medications and my own. Those are all stories we've heard. That catches a legislator's attention. That catches everyone's attention. That's what we're all trying to solve.
It does. And fundamentally, we're all human and right, wrong, or indifferent, everybody has family. So, it's like once they hear these stories, it's like, and whenever I lobby, for any kind of cause, and I say, what if it were your mother? What if it were your grandmother? What if it was your aunt? What if your uncle? I mean, and it really hits home.
Yeah, and since we're talking healthcare, how about when it's you?
Right.
'Cause everybody's going to need a pill sometime.
Yep.
Well, let's not say that.
But hey, we're getting older. It's gonna
No.
have to take something
No.
sometimes.
Everybody's not going to need a pill sometime. I mean, we also talk about holistic health. But,
Everybody's going to need a pill.
well, anyway, we want the option of having the pill when we need the pill. That's what everybody
and like
needs.
you were saying, whether it's you or someone you know, everyone knows someone who needs prescription drugs to survive.
Absolutely. Even when they're getting older, and we also need the options. And you all, oh my gosh, you all have done such great work in the last 20 years.
Oh,
Can't wait to see what the next 20 years.
I know, right? I mean, I can't wait to see the end of this legislative session. I mean, you all, and next one, you all have got a lot of work to do.
Well,
But healthcare, give us the website again, so I don't mess it up.
It is healthcareforall.com. And I want to make sure to thank our coalition partners, and especially the AARP, the NAACP, 1199 SEIU, and the hundreds of other organizations that advocate for these policies. We wouldn't be able to do it without them. And that diversity, all these faith, labor, business, community organizations, that's what makes us strong.
Yeah.
Absolutely. Oh my gosh, when you said 1199, it just brought back such fond memories of lobbying with them and working for all the healthcare initiatives. Thank you so much, Stephanie Klapper.
We should clap. Man.
We should clap for Klapper, right? Yay. Stephanie Klapper. I guess you get a lot of jokes about that, do you?
It's okay.
No, it's okay
Yeah.
because we tell jokes on Urban Health Beat because we believe that laughter is the best medicine. So I'm going to ask you, why shouldn't you tell an egg a joke?
Why?
Because it could crack up.
Okay. That's the answer. You're good. See, Stephanie Klapper. Let's give her a clap.
We're on the
All right,
same
clap.
wavelength.
Sorry, so you almost made me drop my whole
Sorry.
folder. It could crack up. Okay. I'm challenged now. Okay. Why did the banana go to the doctor? Did you look over my shoulder?
No.
Because it
I
wasn't-
didn't. It's written there. I could have found it.
Because it wasn't peeling well.
Oh.
I know, that's really bad. Okay, but congratulations, Stephanie Klapper. We're going to have her back. We have to have her back because she is really good. Thank you so much.
Thank you for having me.
From the Maryland HealthCare Initiative. Okay, if I got it right.
Yep, Maryland Citizens Health Initiative.
Maryland Citizens
and
Health
our
Initiative.
Maryland HealthCare for All Coalition.
HealthCare for All Coalition, and the website is
It's healthcareforall.com.
.com. And you are listening to Urban Health Beat. And remember, until next time, your good health is a work in progress. So work it.
For the Orioles, the designated hitter, number 33, Eddie Murray.
Welcome to Sports Central. Our guest is Hall of Famer Eddie Murray.
Glad to be here.
You're one of Maryland's all-time favorite athletes. How would you like your fans to remember you?
Well, right this moment, I'd like them to remember when they called me Easy Eddie.
Why is that?
Starting this year, there's an easy enrollment for HealthCare if you're not already insured.
I know about that. Marylanders can apply for health coverage by checking a box on their state income tax return. The state will begin the process to offer free or low-cost insurance to anyone who qualifies.
Yeah, on your tax form, just say yes to HealthCare. It's that easy.
Thanks, Eddie. If you need health insurance, say yes on your Maryland tax return. It's a home run. For more information, see MarylandHealthConnection.gov. Sponsored by the Maryland Citizens Health Initiative Education Fund.